All right. So let's go ahead and stop the slides and we'll get started. It's a couple minutes after noon, trying to let people log in and get connected with us. And I'm sure other folks may be a little bit later logging in. So hopefully they'll, sort of join us as they're able. So Lori, you are recording. Okay, we want to remind you that this will be recorded and available later on our website, on our YouTube channel. So welcome to the Community Behavioral Health Information Technology Coalition. My name is John Glover. I'm a licensed clinical social worker and a project specialist here at Metastar. And Metastar is providing this as an opportunity to try to help our clinics talk with each other about various health IT topics. And so we're really excited to be hosting this. I want to just remind you, if you will, try to enter your name and organization in the chat, try to help us keep track of attendance. We'd love it if you can use your camera. We'd like to see folks. If you prefer not to, we understand, but it's really okay. Since this is your lunchtime, please feel free to eat. we know that this is that period of time for you. Remember to mute yourself if you're not talking, and as difficult as it can be, try to remember to unmute yourself if you're going to participate in the discussion. And then please do participate in the discussion, because we are here to learn from each other and share resources together. So let me go over a little bit of what the agenda will look like today. We'll start off with some brief announcements. We'll do some introductions. Then we'll have our topic presentation. And today, Patty Connolly of Vantage Point Clinic and Assessment Center in Eau Claire, Wisconsin, is going to present that for us. And then we'll jump into our discussion and talk a little bit about our topic. And that topic is group therapy privacy considerations. And then we'll end up with sharing some resources with you that we found that we hope that'll be helpful in regards to this topic as well. So let's look at the announcements. The first announcement today is that DHS is having a stakeholder engagement work group, and it's for Medicaid telehealth expansion. And if you haven't attended this, you may want to think about it. They're seeking community partners and stakeholder feedback on telehealth expansion. The next meeting is February the 8th from 1 to 3 p.m. They address topics like network adequacy, interprofessional consultation, medication therapy management, E&M codes, behavioral health, and I think on the February 8th agenda is telephone-only services. So if you are a clinic that is, really interested in audio only or telephone only services, you may want to join in for the February 8th work group and let them know what your concerns and needs are in that regard. The other announcement is our Health IT Radio here at Metastar has a podcast that Lynette Hesse was able to arrange for us with Dr. Jonathan Neufeld of Great Plains Telehealth Resource and Assistance Center. And he does his podcast on telehealth tips and tricks. So if you want some tips and tricks from the source, so to speak, that would be a great one to tune into. Additionally, check out the other podcast on our Health IT Radio, because there's lots of good information there that might be interesting to you. And they're all pretty brief and quick and easy to listen to. All right, so let me tell you a little bit about the group process. Our group is not a webinar. It's really a topic-focused learning group. So the majority of our time is spent discussing the topics that you identify as important. In order to assist you with that, we've created a standardized topic presentation form just to guide you through some simple questions and leave you a place to ask your questions so that the group can respond. So if you're interested in presenting on a topic, please email your project specialist or call us here at Metastar, and we'll be happy to talk with you about it. At the end of the session, as I mentioned before, we'll review some potential additional resources that might be helpful as well. So please join in the conversation, and remember, we're all here to learn from each other. So right now I'd like to get into some introductions. And it looks like, if I could, I'm just going to go through my screen here. And if you would just briefly give us your name, your position, and the practice and location where you are. And so I'll just walk through what I see on my screen. If I miss somebody, I'm going to ask you to help me out there. So can we start with Taryn? Taryn, would you mind sharing with us yours?
Yeah, so I'm Taryn Pratt. I'm from Unified Community Services. We serve behavioral health in Grant and Iowa counties. We have 2 locations in both counties.
And your position there, Taryn?
Health IT Tech.
Health IT Tech. Great, thanks. Next up, I got Dan McWilliams.
I'm Dan McWilliams. I'm the director of Crawford County Health and Human Services, and we have a behavioral health clinic at the county, and we are located in Prairie du Chien, Wisconsin.
Thanks, Dan. And then Jeanette Solar.
Hi, I'm Jeanette Solar. I'm in Kenosha, Wisconsin. I'm the assistant to the director at Oakwood Clinical Associates.
Great. Thanks, Jeanette.
You're welcome.
And Lisa Kay.
Sorry, I have a fire to attend to, but I'm from Brown County Health and Human Services. I'll be on next time.
Okay. Thanks, Lisa. And then Heather.
Hello, I'm Heather Carlson. I'm the Behavioral Health Manager for Ozaukee County Department of Human Services. We are located in Port Washington, Wisconsin.
Great. Thanks, Heather. And Thomas.
Let's see. I'm Tom Jensen. I'm the Director of Behavioral Health up in Ashland, Wisconsin. We have a 10-bed inpatient distinct part unit and a full spectrum outpatient facility as well. I'm associated with Memorial Medical Center.
Memorial Medical. Thanks, Tom.
You bet.
And Cheryl.
Hi, everyone. I'm Cheryl Kettlehut. I am the CCS coordinator at Taylor County.
Great. Thanks, Cheryl. Next up, I have Melissa.
Sorry, late to the party.
That's okay.
I'm Melissa Kempfer. I am the mental health program manager with Church Health Services in Beaver Dam.
Great. Thanks. All right. And then I got Kristen.
Hi there, I'm Kristen Barreca. I am the Clinical Services Manager at Guest House of Milwaukee. We are a mental health and AOTA clinic, and we also have a variety of different case management programs, housing programs, etc., located within a men's homeless shelter. However, in order to access our services, including the clinic that I oversee, you do not need to be homeless. So again, we just provide a wide variety of services.
Sounds like it. Thanks, Kristen.
Thank you.
And Kimberly.
Hi, I'm Kimberly Burgess, the Medical Records Director and HIPAA Privacy Officer from the Fond du Lac County Department of Community Programs. We have outpatient services that include mental health, AODA, children's services, birth to 3, CLTS, CCS, and then we have a 25-bed inpatient acute psychiatric unit.
Wow. Lots going on
Yeah,
there.
we're busy.
Yeah. All right. And then I have Laura. Laura, you're muted. Can you unmute yourself?
Is that better?
That's better. Thanks.
Okay, I tried the space bar and it didn't work. So
Okay.
I am with Mercy Health Behavioral Health in Janesville, Wisconsin. And I am a supervisor, and I kind of cross all the programs between inpatient, partial hospital, and clinic. And I apologize, I'm at a desktop that doesn't have a camera today. So.
Oh, okay. Well, we're glad you could join. And then I have Thomas. Trent?
Hello, Tom Trin with Ozaukee County Department of Human Services. I am the EHR database and system administrator for behavioral health and the counseling center.
Great, thanks, Tom. All right, if I missed anyone, please let me know. Otherwise, I'll introduce our team. Didn't miss anyone? All right. So running our slideshow and sharing documents for us is Lori. And so Lori Mantefeld will be handling that. In the chat, feel free to connect with Julie Schmelzer. She's going to be monitoring chat and helping us with that. Chris Becker is also with us, and he often will throw resources and questions and thoughts into the chat, so that's always helpful. And then we have Kevin joining us as well, and he's always helpful, you know, in the resource area and sending out the notes and things after the session is over, so really appreciate his work with that. And we also have our director, Emily, with us today. So let's just jump on in here to the topic presentation.
Hey, John, this is Julie from the chat. I'm just going to jump in and say we forgot to mention Lynette Hesse is with us too from our team at Metastar.
Oh, yeah, thanks, because Lynette's over with Patty, and I didn't see her on there. Thanks, Lynette. We appreciate your helping Patty out with that. I know Patty appreciates it. Okay, so let's jump into the presentation. Our presenter today is Patty Conley with Vantage Point Clinic and Assessment Center in Eau Claire, Wisconsin. Patty's the HIPAA compliance officer at Vantage Point, and she's the manager of both their privacy and security aspects of the clinic. So she's going to kick off our topic today about telehealth group privacy considerations. And Patty, feel free to tell us a little bit about Vantage Point as well, as if you'd like. Uh-oh, we're not hearing you. So I see you're unmuted, but we're still not hearing you, Lynette. Give them a second here to try to figure this out. We actually hooked up right before we started today, and we had them change seats, and we could hear Patty fine. So not sure what's happening for them right now.
Lori, this may be a silly question. Is there anything overall Zoom-wise we can do to make sure their voice is heard? Or doesn't that affect it?
You know what? They are unmuted and everything, so.
Lori, can you hear us?
I can hear you just fine. I think we can all hear each other. I don't know if Lynette.
Yeah.
We have a suggestion from the chat to try calling in by phone and then using computer and phone.
That's what you're doing. It sounds like that's what they're doing. Thanks, Patty. We'll give you a second to connect up by phone.
Meanwhile, John, I do have the presentation form here up. Is this a good size for everyone?
I can see it real well.
Okay.
And just for those of you who've joined us, this is the form, you know, when we have a presentation, what we're really looking for is not that you have necessarily answers, but, you know, questions. And so what Patty has done for us today is really sort of talk a little bit about what they've been wanting to do and have struggled to get underway, and have some questions for us about maybe how some other folks have managed it. So really interested in hearing more about, you know, what they've done at Vantage Point and how we might be able to offer some suggestions to help them out. So Lynette, can you put in the chat and let us know?
Said that they were muted. Let me see here. I am trying to look for her phone number and
they're unmuted now.
Yeah, can you?
Okay, can you hear us?
Yes.
Yep, we got you.
Hi.
Oh, Patty,
Hi.
thank you for hanging in there with us.
Yes, and this is exactly why I asked Lynette to come over here and hang out with me today. So my name is Patty Conley, and like John said, I am the HIPAA compliance officer here at Vantage Point Clinic, and that encompasses both doing the privacy role and the security role. Little background in Vantage Point Clinic, we are an outpatient mental health and substance use disorder clinic. We're in Eau Claire, Wisconsin, and we do have a satellite office up in Barron that's open 3 days a week. Practice size, we have, when we're fully staffed with clinicians, we have about 29 or 30 clinicians here. So that do a mix of all of those things. We have a pretty robust evaluation department as well. So we work with a lot of the counties surrounding us to do various evaluations, whether those are clinical, forensic in nature. So, we're a pretty busy kind of hopping clinic here. So any other background? Okay. So, so I was saying earlier, you couldn't hear me. I also happen to be our OSHA compliance officer, and Lynette and I are in the same room together. So we are being COVID OSHA compliant. So we're wearing, that's why I'm wearing a mask today. So with that, I'll probably just jump in to kind of the topic here. So when, like for many of you, when COVID kind of hit us, and we had to go into telehealth and then figure out how to do so many things. One of the things that came up for us was, how do we do groups going forward with COVID? So there were a couple of issues that came up for us. And one was doing it as we were in the building was not working as an option anymore, because we don't have a huge conference room where we could spread out and socially distance. Physically distanced, doing the 6 feet. So that became an issue for us to do it in person. And for a while, we were completely closed to face-to-face, and we're only doing telehealth. So trying to figure out how to do groups through telehealth also was an issue for us. So we spent some time trying to figure out how that might work for us. And so I think the biggest issue that came up for us around that, and I'm going to speak to the telehealth, you know, with everybody chiming in remotely to do their sessions, was how do we protect and address the security and confidentiality issues that come with doing telehealth sessions in a group setting. which is different than when it's an individual person. If they choose to have somebody else sitting in the room with them, that's their decision. But now when you have several people joining into a group session, how do you control for the people that are in their homes, maintaining confidentiality and not allowing other people to listen in on the sessions that other clients are sharing personal information about? How do we keep people from, taking screenshots or recording the sessions, seeing other people's names and then sharing that out with whomever for whatever reasons. So we happen to work we do several groups. We have an eating disorders group, we have DBT groups, and we have several AODA, substance abuse disorder groups. And part of that is working with people who are in the treatment court. So privacy is particularly important in those meetings because their information getting into the wrong hands could really cause a lot of problems in their lives. So that was the biggest issue that came up for us, was how do we do that? And how would we maintain that confidentiality? And is that just something that's completed in a informed consent form for a group setting where anybody who's choosing to participate is just accepting that those are inherent risks in that? Or are there other things that people can do? Are there ways to protect identity to some degree, like using only your initials and not using names, or various things like that? So those are some of the questions that came up for us. So, and then I think the other issue around that also was, what are the best platforms for doing those group sessions? We use a platform for our telehealth. It's called Doxy, and that works fine for the individual sessions, but not sure that it's the best platform to use for a group session. I know Zoom has been an option out there, but Zoom is also very expensive. I don't remember exactly how much Zoom was a month, but that was a huge consideration for us. So it'd be interesting. I'd love to hear how other people are doing that and what platforms they might be using that are working or not working. I think the Department of Corrections that we work with was using some type of HIPAA compliant Zoom platform for theirs. So be interested to hear what other people are doing. So yeah, those are the two main issues that come up for us, are how do we maintain that confidentiality? What kind of platform? And then are people utilizing a specific informed consent that is different than our normal telehealth informed consent, one that's specific to groups? So.
Yeah, that's great. Thanks, Patty. And the questions, can you see our screen? The questions we have up here, those pretty much capture the questions that you're looking to answer?
Yeah.
I'm going to go.
Yeah.
Okay.
Yeah.
All right. So that's really great. And it's great questions, Patty. So I'm going to open it up to the group and ask you guys, let's maybe start off a little bit with Patty's concerns about the confidentiality and privacy issues and how you're addressing this. Can someone talk to us a little bit about how your organization is trying to manage those situations in groups? Just feel free to unmute yourself and join in.
I'm curious how many people in the group are currently doing telehealth group therapy, or are folks thinking about it?
Yeah, that's a great question, Lynette. So we have some folks with some pretty big organizations. I don't think we've done a poll for that or anything, but that would have been a good idea. Can people just speak up quickly and let us know if you're doing groups, or if you're not, maybe the reason is similar to Patty's concerns. Can you talk about that a little bit?
I can speak from Ozaukee County. We normally run 3 separate groups, seeking safety group, a DBT group, and an anger management group. We have decided to hold off on the seeking safety group because of the processing and the trauma content. We didn't feel comfortable having that via telehealth, mostly for if an individual felt dysregulated after the group, that they would not be, in the building with us to be able to access our crisis intervention unit. But we have been doing our anger management group and our DBT group via telehealth.
And Heather, can you say a little bit about how you've managed the concerns about, patients' confidentiality and privacy, how you've done that?
Sure. So we did go with Zoom for Healthcare as our platform, which is HIPAA compliant. I was looking at the cost when it was mentioned that it was a hefty cost, and it looks like we spent about $4,600 for a year contract with Zoom, and I'm trying to think of how many users we have. I want to say 20, but it's around that ballpark range of the number of users. Within Zoom, there are some security features to ensure that people are not able to use a record function or a screenshot function on Zoom, but certainly there is the ability, just like even within quote unquote normal group, that someone could have a recording device or what have you. And so one of my, the therapist who facilitates both the anger management and DBT group attended a telehealth training early on in the pandemic, and while there is no specifics for group therapy, they really talked about having that conversation prior to entering into group about the really that informed consent piece of, this is involving other individuals, and so you need to ensure everyone's privacy while you're in the home receiving the telehealth. So it's kind of exactly what everyone was talking about. Nothing real fancy, to be quite honest, because of just the fact that it happened under a pandemic. So,
Right. I'm kind of curious, maybe Patty's kind of wondering this. Do you have a separate informed consent for a group telehealth or no?
no, it's a separate conversation that is during, prior to them joining the group about the expectations. We have our traditional informed consent, we have our telehealth consent, but that doesn't have the group component to it.
Hi, this is Laura White from Mercy Behavioral Health, and we similarly do not have a separate consent that we have developed. It's more of a conversation. We are running some groups on WebEx is the platform we're using. And, I apologize, I don't have a lot of detail about it, but what I do recall is that early in the pandemic, we attempted to use it both for our day treatment programs and for some of our outpatient clinic groups. It's been much more successful in the outpatient clinic groups. With day treatment, it was basically a full-time job for a staff person to be on the phones trying to help each of the patients manage getting into it, staying connected, trying to figure out that everybody stayed connected and was present for the entire time so that we could bill them, so there were a lot of logistics that we hadn't predicted, and it was very labor intensive. As patients, got used to it, obviously that improved, but there seemed to always be connectivity issues and those types of things. I know a big struggle is that a lot of people in their homes have multiple people going to school, working from home, and so I think there were connectivity issues on both ends, as well as, as a business to all of a sudden have 30 therapists all doing telehealth from one location. So those were some of the big struggles that we saw when we implemented.
And so, Laura, you are continuing to do your outpatient groups then?
Yes, there's not as many running as we usually have. I would say probably the ones that have, it's a little stereotypical, but the ones that have gotten up quicker are like the ones that are teen groups, and it's nothing for them to be using their phones, and they get the apps, and they're running. We attempted it with one of our Medicare providers groups for people with chronic medical illnesses, and that just did not happen. So we attempted that, and so I think population is a consideration in making those decisions as well.
Yeah, it's kind of interesting, right? That the teen groups are like all ready to go with it, yet the older groups are kind of, struggling maybe with the technology. Is that what you found?
Yes, absolutely.
Yeah. Thanks, Laura. That's really helpful. By the way, do you all use any specific consent?
No, we do not have a separate consent at this time. Interesting. Might need that though.
So are you doing kind of like Heather said, relying on a conversation with the participants to, request that they maintain privacy and security?
Yep, both before they start, we have that conversation, and then, the clinicians do monitor. If they sense that there's other people that might have entered the room, they address it at that, immediately. That's pretty much it.
Great.
To that monitoring piece, we've been lucky to have an intern with us during this time, and we've had the intern help us facilitate and monitor for those areas as well, and to help triage all of the technical difficulties and stuff as well. So it is like you mentioned, very labor intensive. It's not just like putting together a group in normal office conditions. So.
Yeah, some really extra effort to go through to keep all those folks connected, I bet.
John, can you hear me?
Yes.
Oh, you can hear me. Okay. So I would just wanted to chime in a little bit on the informed consent. Just kind of chatting with here, Lynette on the side. And I think one of the things that comes up for me in my brain is I think we would want something very clearly spelled out in like a group informed consent from a liability standpoint, that it's just clearly articulated what the risks are that are associated with that for those clients that are participating, because not that we don't trust our clinicians to be having that conversation, but to us, everything goes back to if it's not documented, it didn't happen kind of thinking. So I think from our end, I think we would probably want to either add something to the current one that relates to groups, or make a new one that incorporates those specific risks that are inherent with doing groups and confidentiality around that. So just my thought about that.
Yeah, and I agree, Patty. I have seen some examples of forms that do just what you're saying. They spell it out that participating in the group, you realize that we don't have, control over the potential for, these kinds of things. But they do ask that people, comply with it, and, and sort of point out that it's a legal situation if someone's caught, not maintaining the privacy. So.
One would think that you would be able to glean, if you had a separate group group therapy consent form, that you would be able to glean the vast majority of that into a telehealth one. Because I mean, I would think that the issues are very similar. It's just the means to which people might be doing it may differ.
Yeah, I would agree with that.
So here at Oakwood, we use the Zoom for telehealth platform, and we do have a consent form for telehealth patients. That we send it via send it for electronic signature. We also have a spot on the form in the event that there's an emergency during the session for whatever reason. We have a phone number and an email. Emergency contact information is right on that informed consent as well.
And Jeanette, do you do like Patty was saying, do you put in writing there that the participant recognizes the risks of privacy and security?
Yes.
Yeah.
Yes.
And you include an emergency contact. That's kind of a nice extra there if someone needs to reach out, huh?
We have the emergency contact. We have the specific instructions if there's an issue with connection. We have, I just kind of keep going back to look at it. You know, what to do if there's technical problems, emergency contact. We inform them of their treatment rights and responsibilities. I mean, there's a lot on there. It also tells them where they can go if they need to review any of the specific details in person or in more detail via the portal, the patient portal.
It sounds like you've done a lot to make sure you cover all the ground there.
Yep.
So I wonder if Patty wanted to reach out, Jeanette, would you be willing to share your document with her and talk to her a little bit about what you did there?
Absolutely. Absolutely.
Okay.
Or could that be shared with the group as a whole in a follow-up email to the group?
I'll leave that.
Yeah, I would have to double check with the director, but I don't think that would be a problem.
Yeah, I mean, we would of course need to do that. Just saying that this is an example that Oakwood uses, and you can, of course, see what someone else has done to address those problems, right?
Yep.
So we'll follow up on that, but otherwise, maybe we can see if we can connect you, Patty, with Jeanette directly to talk a little bit about that.
That'd be great.
Anyone else? I know we have some other larger groups on here. Are you not doing groups, or Lori had a good question. What tends to be the size of the groups? Because I'm imagining, the bigger the group gets, the more unwieldy it might become. What kind of size are you seeing in your groups?
Ours are here about at 8.
About 8?
Mm-hmm.
So for us here, that sounds about average, probably 6 to 8, sometimes a little bit more for our DBT groups. So that became an issue too. And because for a while we were thinking, oh, we could just put them in 2 separate rooms and try and connect them to a group chat too, but that became a headache. And I think there were some concerns about the loss of the group cohesiveness when they aren't all in the room. So I'd be interested to hear for those that are actually doing groups. What are your experiences around if they're all telehealth? How is that cohesiveness of the group working when people aren't actually in the same room with each other. Because I think that was one of the concerns that we were having here as well, that some of our clinicians were experiencing concern around.
Yeah, it's a very different environment being in a video conference versus in a room together where, you know, you can really sort of feel people's presence.
Yeah.
The experience at Ozaukee County as far as size, they've been smaller than normally what we would have in person. I think our largest group has been 5. As far as the cohesion, like I have been really quite impressed overall with our clients' ability to be resilient throughout this time, and they've adapted. And I think for some of those clients who may struggle with some social anxiety, there's a little bit of comfort having some distance, especially when they're new to the group. But I think once they get kind of comfortable with what the telehealth component looks like, my facilitators haven't noticed much difference with regards to the group cohesion or group interaction. We have had to speak with clients about kind of their setting. You know, there was one client who was like laying in bed, and we're like, I don't think that's the best. You know, let's talk about another setting you could have during group session, but we're dealing with that during individual sessions as well. So.
Yeah, it's great, Heather. Thanks a lot. I mean, obviously, we still have the same kind of group issues, right, of having to address people's behavior in the group. So that's not too different. But yeah, you know, so other people, anyone else willing to jump in and talk a little bit about what you're doing in groups?
Sure. This is Tom from Ashland.
Yeah, thanks.
We're currently doing kind of a hybrid. We're letting the client decide what they're comfortable with on any given day. If they're not feeling well, they can still join virtually. Otherwise, we have been able to find the facility that will work for 6-foot distancing and safe for safety. We had to be a little creative on, like, we have a conference phone that's in the middle of the room, and so you can hear everyone speaking rather than using the computer speakers, and then using the laptop camera. So the image is small, but they can hear everyone in the room speak real clearly. They created a safe word for all participants. So if they use that word, that means that their environment is compromised safety, or is compromised in privacy, as a heads up to the rest of the group that this is, I don't recall what word it was, but it's something they as a group decided that if this word is used, just said, nobody else in the room would know what it means, but it does mean something to the rest of the group that telesite is no longer safe for the group or for them. And that's worked well. They talk a lot about consent, you know, dress, appropriate behaviors. I think we do have a separate consent, but mostly it keeps going back to lots of discussion about appropriate and inappropriate, what the risks and benefits are, as kind of a group discussion on a regular basis. And I think the quality engagement, I think, has been fine. It's just your typical, you know, some groups are quieter, some are more engaged. Those are some of the things we've been doing, mostly in person right now.
So mostly in person, but with the ability to sort of come in virtually if you can't make it or something like that. Tom, really creative on your group's part with the safe word.
Yeah, they read it somewhere and they really liked it.
What a creative solution. I'm always impressed by the things. This is one of the reasons we like to have these discussions, because it's really amazing the things that people have come up with, the creative solutions to help manage some of these situations. That one in particular, I had not heard that before. It's just a wonderful way, right, to let everybody know, like, hey, this is going on right now. I wonder if do they have a way to undo it? It's okay again?
I'm sorry?
Do they have a way of sort of undoing the safe word situation so they, like everything's fine now?
I don't know. Maybe they just say it.
Yeah,
I'm not really
right.
sure.
Maybe so. Yeah, that's great. All right.
John, this is Julie. I have a question for Jeanette about her consent form. Did you receive any feedback from the participants about, maybe where they didn't want to participate after seeing the details of that, or has it been pretty acceptable?
It's been accepted. I haven't had one person come to that I'm aware of. No one has said anything like, this is making me concerned, or now there's also conversations that are happening between the therapists and the group members and therapists and individual sessions and things like that prior to getting that form. So it's not like they're getting the form and they don't have a clue. so there is discussion along with, we're sending you this. It's not something that's going to overwhelm them or cause anxiety to spike. So.
Yeah, that's great. Thank you. I just was curious about that.
And that's really nice, Jeanette, because, it's also a way to say to the patient, this is very important. It's very serious. We want to make sure you understand and that we're doing our best to ensure that privacy is going to happen, so people have to sign these. And so, I think that's a really nice way of emphasizing the importance of the security and safety in the group and confidentiality. Thanks. So I wonder, Lori, I think you said you'd put together a quick poll. Could we throw that poll up and just get an idea of, how many folks are actually trying to do the group therapy? And
Sure, John. I just threw the poll up there. So if everyone, it's just a simple yes, no. The other thought I had is that I know there were questions about platforms. And so if the participants maybe would want to share which platforms they're using in the chat, that may be interesting as well.
Yeah, I know that was definitely something else Patty was interested in. So I know we're running short on time here, but yeah, if you could throw that in the chat for us, we would be able to share that as well with Patty and let her know. So it looks right now at the poll, hopefully everybody's kind of had chance. It looks like about a 60-40 split. About 60% of people are trying to do groups and about 40% still aren't doing them. It sounds like from our discussion today, there's a lot to be considered when you're doing a group. And so I really, appreciate those of you who are working your way through it and trying to provide that, as well as those of you who are, making sure that you're not doing it until you're feeling comfortable that everybody's safe and going to have a good experience. Thanks, Laurie.
And John, the two platforms mentioned in chat are the Zoom for telehealth or Zoom for healthcare and WebEx, which I'm assuming WebEx is HIPAA compliant as well. I think that's Jeanette's platform. So those were the two that showed up so far.
Okay, great. All right, so to respect everybody's time, we want to kind of tie things up for today. I'm going to have Kevin walk through some of our resources that we put together real quick. So Kevin, can you do that for us?
Yes, thanks, John. So to supplement today's discussion, we have compiled some resources pertaining to some general guidelines around group therapy and how that kind of intersects with telehealth. Next slide, please, Lori.
Hang on.
It's okay.
Sorry about that.
There we go.
We also compiled some resources regarding the privacy and security considerations, which I know has been a topic of today's considerations and conversation. And then lastly, one last slide, Lori, is just an Addiction Technology Training Center webinar series. So these are a webinar series focused on effective virtual group counseling training sessions being held on those dates there. And as a follow-up, all of these resources will be sent out with today's session notes, which will be sent out within the next week or so, so be on the lookout for that. And then additionally, if you have any resources that you guys utilize or have utilized in your consideration for group telehealth therapy, I invite you to share those in the chat as well. And I can incorporate those into our supplemental meeting notes.
That's great, Kevin. Thanks. You know, and I failed to mention in the announcements, I talked about the stakeholder engagement work group and the podcast, and we're going to have Kevin include the links to those as well in the follow-up for you so that you can just click on them and register and participate in those if you like. All right. The next thing on our agenda here is to do a review of the topic for next session, and the other topic that you all identified as something you're interested in discussing is EHR optimization. And so that's going to be our next topic, and that obviously can have a lot of variety in terms of, you know, what's discussed or what kind of questions are brought up for the group. But do we have anybody who is interested or willing to tell us a little bit about what you've done to try to optimize your EHR, and, you know, maybe ask some questions of the group of things, you know, that they've done that have helped them? That'd be great. So anybody on today that is able to sort of offer to do that? If not, we can reach out individually and, you know, and see if we can work with somebody.
So at Oakwood, we're currently using the Valent EHR.
Okay.
And am exploring possibilities of possibly doing a switch. So I'm very interested in what other people are using, and especially report capabilities. Everything here comes back to data. So I think I've actually talked to you, John, about EHRs in the past. So we use data in everything. And we actually have created custom fields within Valent so that we can figure out, you know, if somebody starts seeing a peer specialist, what date they start, what date they stop, what day they go to a treatment provider, you know, and if they end up needing to go back to the recovery coach, you know, what date they did, how were they re-engaged. We track everything in Valent.
Okay. Well, Jeanette, would you be interested in doing a little bit of a fill out that form with what you've done and what you're looking to optimize further, and maybe get some feedback from people on some things? Would you be willing to do that?
Sure, absolutely.
Okay, great. So there we have it. So next session we'll be talking about EHR optimization, and Jeanette will fill out our little form real quick and ask some questions, and that'll be our group for March 16th. It'll be our next session. I just really want to thank everybody for your participation today.
John, one just really quick thing that Lynette put in the chat to me is that Patty also had something that she wanted to share regarding grants.
Oh, sure.
So through this whole COVID nightmare that made us go to telehealth very quickly, scrambling to figure out the technology aspects of that and find funding for that was a huge piece of the puzzle for us. So I had reached out to Lynette to see if she had any awareness of any grants out there that would help us pay for technology, such as getting, you know, tablets for all of our clinicians, et cetera, et cetera. So she did send me a link we can get sent out. We did apply for that. Unfortunately, we didn't meet the expectations. There are some guidelines. Our finance lady took care of that. But when we got rejected for that, she did more research, found another grant, applied for that, and we did get that grant. So, I can find out what the information is about that grant, I'm happy to send that out to everybody, or Lynette to get that out to the group in case other people are running into that same problem of just not necessarily even around the group telehealth, but just for our clinicians to be able to be doing telehealth. So anyway, thought I would just share that.
Thanks. Yeah, thanks, Patty. I know that was a real big issue for everybody, right? I mean, trying to move and get everybody with the technology they needed to do telehealth. I think everybody was really scrambling. So yeah, that'd be great. We'll include that in the resources. All right, so we're pretty short on time. I just want to thank everybody, and thanks, Patty. Really appreciate you being willing to sort of open this discussion up for us today. It was really great. Again, our next session is March 16th, and we'll be talking about EHR optimization, and we look forward to seeing you. I hope you can drop in and see us again on that date. Remind you, just, if you have some other topics of interest, please let your representative know here at Metastar, and we'll probably do a poll maybe in March just to check in again and see if we're still on target and what topics are most important to you. So in closing, I just want to thank all of you for all of the great work you're doing out there with our patients, trying to keep them connected and supported during this difficult time. You guys are our heroes. We love you. We respect what you're doing. Thanks again. Hang in there. We're on your side. Okay. We'll see you guys later.
Thanks, John.